So I reviewed this gentleman yesterday. He's doing really well with his NG feeding. He's progressing well. He's still needing his bloods checked. His phosphate has remained quite low, and he is at risk of some feeding syndrome, as you know. So we need to keep a really close eye on that.
Of course, yes.
But progressing very well. I got into dietetics because I had an interest in food. When I was young and working on a Saturday job, I had sort of hospitality jobs, and so I enjoyed food, but I also enjoyed working with people, and this is a great combination. It gives you both. At least part of my day is on the wards. My clinical remit is within intensive care in the main, and also within the gastroenterology ward, so I work up there, and it'll depend on what our patient referrals are like in the day. We'll prioritise our patients according to clinical need. So some of the patients who require tube feeding or intravenous feeding, we would see them first in the day because they're absolutely and urgent to be seen. We would then move on to patients who require some nutritional support, who need dietetic assessment, see exactly what it is they need in terms of therapeutic diets or in terms of other interventions. And then part of my day is also, because I manage the department, part of that is around making sure everyone's okay within the team, making sure the staff are okay, we're appropriately staffed, and we have got all the resources, products, etc. that we need to be able to do our job. So a really mixed day. So the idea would still be that on discharge you would go home sticking to the low fibre diet, try to take some of these products, which, as you know, are designed really for somebody with a gut complaint. It will provide you with a good source of nutrition, protein, vitamins, minerals, but hopefully in a reasonably easily absorbable form, so it should give you minimal side effects. And ideally taking one a day, perhaps up to two a day if you can tolerate that. My memories go way back to those days back in Falkirk Royal when we were down in the basement corridor. That's where the department was. We had lovely old offices, we had a great team, we had a lot of really good interactions with the wards back then. We still do, but it was a much smaller hospital. You knew everyone in the hospital, everyone knew you, and I have very happy memories of Falkirk Royal. This place is wonderful as well. It's just different, it's bigger, with different challenges. So my memories go way, way back. One of the things that we often laugh about was we have water bags which we use to infuse water down tubes, and we once found that a charge nurse back in the day, many moons ago, was borrowing one or two of these to water her tomato plants in the ward as well. So dripping some water into the tomato plants to keep them healthy as well. So we were not just feeding the patients, we were giving the plants some water too. It does seem like 20 years in many ways because so much has happened within that time, but equally I could take myself right back to the days in Falkirk Royal. I can feel myself in that office with the team around me, just enjoying that environment and working in those wards. It's different. It seems like it's a long time ago, but it could easily be yesterday as well.